The placebo effect is a psychological and physiological response where a person experiences a real change in their condition after receiving a treatment that has no active ingredients or therapeutic value. This phenomenon occurs because the person believes the treatment is effective, which triggers the body to respond as if the treatment were real. Placebos can come in many forms, such as sugar pills, saline injections, or even fake surgeries, but their defining feature is that they lack any substance or procedure that should cause the observed effects. Scientists believe the placebo effect is linked to the brain's ability to release chemicals like endorphins and dopamine when we expect positive outcomes. It highlights the powerful connection between the mind and body. Now let's look at some examples of the placebo effect in action. One example is in pain management. In clinical trials for painkillers, some participants are often given a placebo instead of the actual drug. Despite receiving a sugar pill, many participants report significant reductions in pain. This happens because their belief in the treatment prompts the brain to release natural, pain-relieving chemicals, like endorphins. Another example is in treating insomnia. Some people who believe they have taken a sleeping pill, even if it's just a placebo, report falling asleep faster and experiencing better sleep quality. The expectation of sleep leads the brain to relax and prepare the body for rest, mimicking the effects of real sleeping aids. A final example comes from athletic performance. In some studies, athletes given placebo supplements performed better because they believed they had taken performance-enhancing substances. Their belief in the treatment boosted their confidence and motivation, leading to improved results. Now let's look at some benefits of the placebo effect. One benefit is its ability to reduce reliance on medication. In some cases, doctors can use placebos to help patients who don't need strong medications but still want to feel better. This reduces the risks associated with overusing drugs, such as side effects or dependency. Another benefit is that the placebo effect can enhance the effectiveness of actual treatments. When patients believe a treatment will work, their bodies may respond more positively, boosting the overall success of the therapy. This combined effect can improve recovery rates and patient satisfaction. A third benefit is that it demonstrates the power of positive thinking. The placebo effect shows that our expectations and beliefs can directly impact our health. This insight encourages the use of techniques like mindfulness or visualization, which can complement traditional medical treatments. However, the placebo effect is not without its criticisms. One criticism is its unpredictability. Not everyone responds to placebos in the same way, which makes it difficult for researchers or doctors to rely on this effect as part of treatment plan. Some people experience strong effects, while others feel no change at all. Another criticism is the ethical concern it raises. To create a placebo effect, doctors often need to deceive patients by not revealing that the treatment is inactive. This goes against the principles of informed consent, which require patients to fully understand the treatments they are receiving. A final criticism is that the placebo effect is limited in scope. While it can help with subjective symptoms like pain or anxiety, it cannot directly treat diseases or physical conditions, such as infections or broken bones. This limits its usefulness in many medical situations.